Hello everyone, welcome to United Families Healthcare Health Talk. I'm your host Winston Louis. Today we're delighted to have Dr. Tong, Chief of Emergency Department, joining us to talk about the treatment of open wound injury and cosmetics suture. Okay, welcome.
Thank you very much.
First things first, for those who are unfamiliar, can you please introduce yourself?
Okay, so my name is Tong, and I am a UK trained emergency physician. So I did all of my schooling and medical school training and my specialist training in the UK. And I had been working in the National Health Service in the UK for almost 30 years before I came here to Shenzhen.
Thank you. Okay. A situation in which, let's say, the plastic surgery department and your emergency department move across the most would be when a patient comes in with an open wound surgery needing treatment. Can you tell us a little bit about the procedures which you guys would take in the emergency department when you have these kind of patients?
Sure, yeah. So I suppose many of the cases would be particularly children who have head injuries, and the parents are very, very keen for what they call cosmetic suturing to try and minimize scarring. Now, clearly, because it's affecting the head, I think our first priority has to be to make sure that there is no suggestion of an internal injury. So our initial assessment would be to make sure that there's no reason to do a CT scan or anything like that, to make sure there's no bleeding around the brain or inside the brain. After that, then is the consideration of how to manage the wound, this is where your specialism comes into being very, very important. So we do ask for you guys to come because the parents want to have a really good quality finish to wound closure.
So, as I'm aware, there are basically a few options for treating an open wound, such as steroid strips, suturing, and tissue glue. So, do you mind telling us what are the ideal situations for using each of those?
Sure. So of course, ultimately suturing is the standard of treatment. However, it is painful, and you also have to put in local anaesthetic to try and make it as comfortable as possible for the patients, particularly for the children. So it is well established that in terms of the use of glue and steroid strips, because they're much easier to apply and generally quite comfortable for the children. And I have to say, in the UK, I went through a period of about maybe 2 or 3 years where I didn't refer anybody for suturing at all, because essentially the wounds that came along we were able to manage quite simply with glue and steroid strips. Now, the disadvantage of glue and steroid strips is that obviously they only apply to the surface. So if you have some very deep wounds, they don't close the underneath part of the tissue. So the wound may not be quite as good for the deeper wounds, but certainly for the superficial wounds, which are very close and just involve the top part of the skin, glue and steroid strips give you a very, very good finish, as long as we can get the edges together very well. Generally speaking, glue is sort of recommended in wounds which are perhaps shorter than 3 centimeters. The only exception to that is that sometimes when you have a scalp wound within the hair, there is a technique that we use here where we actually use the hair like a suture. So we sort of grab bits of the hair on either side of the wound and twist it, and then we glue the hair, and that actually allows us to manage perhaps longer wounds within the scalp. So I get very upset when people shave their hair off because then we can't do it. And actually suturing scalp wounds is quite difficult because it's really hard to put local anaesthetic into the scalp. So that technique with the glue is really, really good. Steroid strips similarly are really great for if you need to actually apply some tension into the skin to bring the wound edges together. So it's easier to do that with steroid strips than with glue. There's a sort of very particular technique with applying steroid strips because you actually then have to stick one side down and bring it across to the other side to make sure that the wound edges do come together very well. Because what we don't want is for the steroid strips to essentially keep the wound apart, and that can be done that can happen if you don't apply the steroid strips really well. The last thing about steroid strips is that it is not very easy to, and with glue, is that they're not very easy to apply when the wound is still bleeding. Because when the wound is wet, the glue doesn't set quite so well, and obviously if it's wet, then the steroid strips won't stick.
So after treatment of the open wound, what would you suggest to minimize scarring?
Yeah, so the key thing is that the wound is actually put together really well, and that, that's as I say where you guys become very important. And actually, once the wound has been closed well, certainly with suturing, there's actually a lot of emerging evidence that the wounds will do very well whether you get them wet or not. So traditionally, we've always said to people to keep the wounds dry. And you do need to do that with steroid strips and glue, because obviously if you wet those things, they come off. Whereas when they've been sutured, the thinking now is that you can probably allow the wound to get wet, but as long as you sort of make sure that you dry it well afterwards, then they probably do just as well.
Perfect. Thank you, Dr. Tong, for your wonderful insights. I've learned quite a bit today. And that concludes our interview. So we'll see you next time. Okay, bye.
Bye.